Back, the coronavirus continues to impact schools as states struggle to get testing supplies, and some states are preparing to reopen now. A lot going on this morning, and I want to join Dr. Amy Edwards. She's from University Hospital. She's here now to help us sort out the situation. Doctor, first of all, good morning. Good to see you.
Good morning.
All right, let's talk about where the situation stands right now here in Northeast Ohio.
We're doing great here in Northeast Ohio. Our numbers look good. We had a little bit of an increase over the weekend, but nothing major. It wasn't like a huge log rise or anything like that. And we're still seeing kind of breaks between patients, at least at university hospitals. You know, a patient will come in and we'll actually have a break of 12, 24 hours before another one gets admitted. So we're doing good.
As far as canceling school or making school online for the rest of the year, in your opinion, why is that good medically?
Well, you know, we keep talking about kids not being at risk for this virus. And while that's not 100% true, we have unfortunately seen children around the United States die from this virus. The main role that children likely play in an outbreak like this is asymptomatic carriage. You know, kids don't do social distancing. They see grandma and grandpa, they got to hug them. They see their best friend, they got to hug them, and they're just going to spread that around.
Yeah, they're carriers more than anything else, in fact, if they have it. Let's talk about testing. We're hearing, you know, the federal government saying, you know, there are enough tests out there, but some states are saying we don't have enough tests. What's the situation like here in Northeast Ohio from your point of view?
We've got enough tests to deal with what's going on in our hospitals. What we don't have capacity for is the community-based testing that we need, because really to track this virus, we've got to be doing testing out in the community. We've got to be following this outbreak in the community, and the hospitals don't have the capacity for that. And that's where the state's trying to step in, and Governor DeWine has rightly called for more resources to do that.
When you talk about community-based testing, basically, what are you talking testing? Everybody? I mean, how would that proceed if we did something like that?
Well, testing everybody, that's a great idea. You got enough test kits for that?
No, I'm just saying,
no, you're talking about a certain percentage of the population, both symptomatic and asymptomatic, are going to have to be tested on a regular basis so that we can track where this is and who might be sick.
We're talking about opening the economy on May 1st. From a medical point of view, is that a good thing or bad thing?
I think we're ready as long as we have our testing up and as long as the hospitals continue to get supplies of PPE in. I think we can do it. But what people have to understand is an open economy doesn't mean just go back to the way things were before. We still have to do the social distancing, the frequent hand washing, and people that can stay home should stay home as much as possible.
Your greatest fear, if in fact when we open on May 1st, what's your greatest concern?
That everybody will go back to the way it was before, and 6 weeks from now we'll be dealing with a big outbreak again.
All right. All right, Dr. Amy Edwards from UH, thank you very much for your information this morning. Stay safe out there. Appreciate the work that you're doing. Thank you.
You have a good day.
You as well. Thank you.